Hello, my friends, and welcome back to the Patients First podcast. I'm your host, Dr. Bryan Laskin, and I'm very excited that you're here. And I have to you today an idiom, one of my favorite idioms that I like to say over and over again. You know, I've said it before on this podcast, but I think cliches are not appreciated enough. Cliches are cliches for a reason. Most cliches, I find that there's a little bit of wisdom in there that's easy to forget because we hear them all of the time. That's not what we're talking about today, but because I don't think most people have heard this idiom that I like to say over and over again. But I've also noticed that people that I've met that have some degree of success have these idioms that they sort of repeat over and over again. And what I've found is that the reason why people with success repeat idioms is they're reminding themselves as much as they're informing you because they've found some simple truths in their life that have led to their success. And today we're going to discuss one of those idioms that I, repeat to myself all of the time. But before we talk about that, I want to talk about one other big issue to discuss, and that's the difference between urgency and importance. Something being urgent means that it's something that we need to deal with at this moment in time. Something that's important means that it doesn't need to be dealt with right now. Maybe it is urgent also, but so it does need to be dealt with at this moment in time. But it has a huge impact on whatever we're thinking about. Couple examples. So I'm going to the Star Wars Hotel because, as I've mentioned on this podcast before, my family are all Star Wars fans, nerds, whatever you want to call us. But and super excited for it. So we're leaving the day after tomorrow to go to the Star Wars Hotel. So packing to me is urgent because we're going to this trip. So if I don't pack stuff, I won't have any clothes. I won't have a toothpaste. Uh, I won't have my twice toothpaste when I land in Orlando. So it's urgent. Now, is it important? Frankly, if I landed in Orlando with nothing other than the clothes on my back, I would still have my credit card in my pocket, and I there's plenty of stores in Orlando for the 3 days I'm there. I could buy a couple T-shirts and some twice toothpaste, and I'd be ready to rock. Right. So it's not really important, but it is urgent because if I don't pack it, then I'm going to be inconvenienced and have to go buy some stuff. Right. So, frankly, I'll be buying clothes anyway. I'll probably be buying enough Star Wars clothes that I could clothe myself for 2 days. So, anyway, I digress. But it's not important. It's urgent. If I want to arrive there with some stuff that I normally want to have when I travel, so it's urgent. However, is it important? No. What is important? Well, teaching my son to drive right now. My wife is it's doing that, so thank you. But that's important, right? Because it's a life skill that my son is learning, and his safety is of the utmost importance to me and to him and to my wife. So teaching him the skills of driving safely is important. If he didn't learn how to drive right now, that'd be fine. He could learn in 6 months or a year or whatever. But it's an important skill to learn. So that is important, not urgent. So will I take my son to learn to drive, or will I pack tonight? I'll probably pack. And look, that's the way the world works. So we tend to focus on what's urgent, not important. Why do I bring that up when I'm talking about idioms? Well, it's because this difference between urgency and importance has been a spotlight's been shined on it in my life in the last month because I'm not in my dental practice much anymore, which I believe allows me to see the forest through the trees. Speaking of cliches, the forest through the trees is really talking about urgency versus importance. And because I'm not in my practice every day, I don't feel that urgency of all of the day-to-day activities. And so when I do pop into the dental practice every couple weeks, I get to see what's important and hear about what's urgent, and I can have a perspective that's different than the day-to-day activities. And that's kind of what we're talking about today. So I want to talk about both in my life and how you can benefit from it. The importance and the urgency. Important. What do I think is important in dentistry, in the industry? So, as I've mentioned before, I've really retired twice. I sold my dental practices 4 years ago to a large group, and I sold Opera DDS phenomenal platform that's part of a great company called Vine Dental now, about a year and a half ago. And when I had that second exit with Opera, I realized I was in a unique opportunity to focus on what I believe to be the most important issues in dentistry. By important, I mean elevating care, putting patients first. But so the two things that I think are the most important to do in dentistry right now, personally, and if you disagree with me or if you agree with me, please comment. Let me know what you think. I love hearing from you, patients and dentists and dental professionals. But what I believe to be the most important issues in dentistry to help patient care and dentists get what they deserve is removing the barriers to innovation and advocating for patients. Both of those two issues, I believe, have been missing in our industry. There's been some chokeholds on innovation and also a lack of patient advocacy or looking at things from the patient perspective. See my first book, The Patient First Podcast. The second book is about the other issue, which I'll talk more about on this podcast, coming to Amazon soon. But anyway, I digress. So, importance. How are we helping patients, advocating for patients, and also removing the barriers for innovation over here every day? What I believe, what are the urgent things that we're doing every day to fix those important issues that we see? Well, number one, I'm working a lot in standardization, both at Dental Standards Institute, the standard development organization that I created and helped create, so check that out at dentalstandardsinstitute.com. We're doing all sorts of what I believe to be important work like transparency and insurance reporting and pictograms for healthcare and interoperability standards regarding patients having access to their data. And also through the American Dental Association, the standard development committee at the ADA, where just co-authored a standard on interoperability called ODIN, the Oral Data Interoperability Network, which is focused on what I believe the biggest barrier to elevating care, and that is interoperability, having secure, open sharing of information. If a patient moves from my practice in Minneapolis to your practice in LA, you shouldn't just have a couple crappy X-rays and a treatment plan. No, the entire dental record should go with that patient so that if that patient has a failing endo, and I wrote when I did the endo that there was a crack on the pulpal floor, so I don't know if that tooth is going to, if that root canal is going to work, you should have that information, right? That changes the treatment plan fundamentally. And too long in dentistry, we've been okay with not having the access to information that vitally describes what's going on with that patient that affects their treatment. Let's face it, putting patients first and providing the highest level of care, it is essential to have the information that we need, and we don't have that today because of the blockages in information that's been going on in our industry. And that is what I'm working on, both from a standard level to align the profession and on an innovation level through Toothapps. So Toothapps is really revolutionizing dentistry by allowing dentists and patients to have access to the dental records and information. To check that out, go to toothapps.com. We're doing everything from having a fully integrated calendar, so you can have your Apple calendar, your EagleSoft calendar. You can build directly from your calendar. It's an actionable calendar that brings everything in your life together. Whether you pick your daughter up from soccer to when you have a patient in the chair, and you can see the notes. It's really cool what you can do. The things that are open up, the the ways you can elevate your productivity, profitability, and patient care when you have all the information at your fingertips in your phone. That's what we're doing at Tooth App. So check it out. It is, I believe, to be one of the most important ways to elevate our care. Is it urgent? It's up to you, but I believe it's both urgent and important. That because urgency and importance, if you have a heart attack, getting to the hospital is both urgent and important. And I believe that removing these barriers to patient access of information, to the access for for dentists to have access to that data is both urgent and important. That's why I'm working on it. And the third thing that I'm working on is education, because we can't make these changes without letting people know. And we're assembling the Avengers of dental education, so to speak, to make it easy to get education remotely on demand. When even a few years ago, it was expected for you to fly across the country and sit in a conference hall for a day, eat a bad chicken lunch to to get dental education. And there's a place for that, and there always will be. But trade shows, I believe, should be optional, right? If you want to go across the country to get the education that you need, absolutely. That is always going to be available. And frankly, it should be elevated. I think there's a few trade shows that are really focused on increasing the experience so that for people that want to have that experience are elevating it. And I think it's great. But if you have small kids and you don't want to fly across the country to learn about how to do endo, or if you're not doing endo today, you should be able to do that remotely. And that's what we're empowering over at upgradedental.com. So that's the important side of my life right now. Is I'm focused on those two things in three different ways. I'm focused on removing the barriers to innovation in dentistry and advocating for patients. And I do that through Dental Standards Institute and the ADA standardization. I do it through Toothapps innovation and through Upgrade Dental's education. If you think that there's something more important than those two things, innovation and patient advocacy in dentistry, I'd love to hear it, right? The only other thing that I can think of that's as important in dentistry is really we're going to be talking about urgency, and that is team members. I think, however, I don't think it's as important because I think it's easier to solve than the issues of innovation and patient advocacy. And that's what we're going to talk about today, because a lot of people, I believe, listening to this podcast today, they're going to be thinking, well, having the data isn't as important as getting the next hygienist, right? In my mind, that's an urgency issue, not an importance issue. Why? Because if done correctly, I think you should have people dropping off resumes at your practice, even in today's environment where people are scarce. How? Because if we dealt with the urgent issues in a way that we've fundamentally fixed them, then they won't pop up again. And because I've been focused on these other issues, when I popped into my practice twice in the last month, I saw two urgent issues, and they both came down to what I believe to be focused on the idiom that we're going to be discussing today. Going back to the very beginning of the podcast, if you remember from 10 minutes ago, that idiom is addition or deletion of one person changes everything. I'm going to say it again. The addition or deletion of one person changes everything. And what I've found in my practice over 20 years is that oftentimes people are worried. They're saying, "Oh, the culture's slid, or that there's a problem with the team, or the clinical staff has an issue, or the business team is just not doing their job, or the people who sit at the front desk every day are all of this stuff that goes on in every dental practice way too often, right? So how does that come down to the addition or deletion of one person changing everything? Well, here's how. Number one, are you clear and have you communicated to your team at nauseum about who you are, how you show up at work, and what you do? Think about that for a minute. Does your team, could they repeat quickly without having to think about it, who you are, who the people who work on this team, who they are? Not who do they aspire to be, but when they're at home, when they're at your practice, when they're taking care of their kids, when they're cooking dinner, when they're, when they're playing soccer, who are they as human beings? Because I think that's important to select the right team members. If you're a professional sports team, you probably have a good clue of like who the people are that you want to have on your team. And if we're going to be working together this much, we should know the type of people that we want to work with, not the type of people we want to turn them into, but the type of people that we want on our team. And then when we're at work, what is our focus? What do we do? When we show up to every day at work, we do dentistry. That's not, I don't think that that's good enough. I think we have to have a focus on like, this is our specific way that we do dentistry. For example, one of the three things that in my practice is that, we are at the patient's pace. So if the patient wants to do everything in one visit, we'll figure out a way to get it done. If the patient has big needs, but they want to phase out the treatment, it's up to them. It's their mouth. We are patient partnered, which means the patient sets the pace of their treatment. That's just one of things. Maybe you're not that way. Maybe your practice is we only do holistic dentistry as as efficiently as possible. Whatever that is to you, we should be aligned as team members of who we are and how we do it, right? Then it's fairly easy when there's a problem with the team to look at it and go, oh, what's going on? Let's talk to people and understand what's the breakdown. And oftentimes, it comes down to one of two things. And I had both these things in the last month. Number one, we haven't been clear about who we are and what we do, right? And that's been true in my practice. So I'm going back in and I'm doing a couple presentations and I'm working with, we have a new office manager whose role is to every day reinforce who we are and what we do. Not once, not twice, but after we have this meeting, and frankly, before this meeting, every day, her job is to focus on communicating to the team at nauseum who we are and what we do. It's that important. The number two, the other issue that I just found out about yesterday, going to the practice and, oh, there's a big issue. Everybody's complaining. And turns out, turns out it's one issue with one team member. So no matter how big the problems are in your practice, it typically comes down to at most two people and two problems. I mean, I've never even seen that. I don't think it's usually one person and one problem, but sometimes it's a couple people and the same problem. If there's a disconnect between, they're just not doing what they've agreed that who we are and what we do once it's been clearly communicated. So what's the solve? Well, the solve is to take that person or those two people individually, if they're, conversations I believe should be happening one on one with whoever's the manager of the practice and say, hey, this is what I've seen. From my perspective, there's a breakdown in either, our core values or in how we, what we do, which we call our uniques, how we do things. So, for example, you're pushing the patient aggressively to, you're pushing patients aggressively to do treatment on the way that you would do it versus partnering with them and going at their pace. That's a fairly weak example because it's never happened in my practice, but you get the idea. So then we talk about it and we set the expectation that that's okay if you disagree with our uniques or if you aren't the type of person that we all say that we want to be, that we are when we show up to work, which you were, when we hired you, when you came, when you're onboarded. We've been communicating this all the way along. So if that doesn't fit with you today anymore, that's totally fine. Go work somewhere else, right? Or maybe it is you and you do want to show up and do that work every day. Then we're malal. So let's discuss if I'm not seeing something you're seing, if you're not seeing something that I'm seeing, and let's come into alignment. And if so, great. Now, sometimes that alignment works, sometimes it doesn't work. If it doesn't work, then you can set that person free to go find the practice that is a good cultural fit, meaning that they are the people that that person fits in with, that team is, or they do things the way that they like to do them, but it's not here. And so if you have a strong culture, meaning if you really know the type of people that you want to work with and how you want to do what you want to do when you show up to work every day, you can externalize that and you'll attract more people than you know what to do with. And that's why I don't think it's as important. Now, these are important issues. Coming up with your core values, with your uniques and how you do things, I believe is important, but it shouldn't be urgent. That is something that takes time and effort to come up with. But when it is, then it becomes just an urgency, not an importance to realign with people that have gone off track. So it's important if everybody's gone off track, like my office was a month ago. Then it's important to get everybody educated on, okay, this is who we are and what we do. Period. End of story. So if it doesn't fit with you, that's fantastic. At least we found out today, not tomorrow. That's important. Um, so hopefully that's been helpful. I think, now keep in mind too that these aren't just for your dental team, by the way. Having the addition or deletion of one person fundamentally change any team, be it your family. If let's say you have a new in-law, if your son or daughter is getting married and coming into somebody's coming into your family, changes the dynamic. My daughter just went to college this year. Obviously, she's still a valued member of our family, and she comes home. But when she's not there in the house during the school time, it changes the dynamic of the household. It just does. The addition or deletion of anybody makes a big difference. And what I've found sometimes to be the most powerful is if you have somebody that's not a good cultural fit, if you free them out to the marketplace to go see a place that's a better cultural fit, and you bring in somebody that is a good cultural fit, it completely changes the dynamic of the team to go from lower performing to high performing. And so that's my podcast for you today. To when you're looking at issues, classify them as either urgent, important, or both, and then recognizing that if you do have problems with your team, that it's usually just adding or deleting one person, or adding or focusing on whether or not you need to add or delete one person. Obviously we want to give people the knowledge so that they can realign and get back on track prior to making that change. So, and also what's most important in dentistry? I believe it to be removing the barriers to innovation through interoperability, having a secure, open exchange of information in dentistry, and advocating for patients. If you disagree, or if you do agree, let me know in the comments below. Thank you so much, and I look forward to talking with you next week right here on the Patient First Podcast.